Okay, welcome everyone to our Best Practice Champion Information Sharing webinar on reconnecting with champions through an evidence-based open house. Today's presenter, we're so delighted to have you, is Camille Brunet, advisor to professional practice, nursing practice at Hôpital Montfort in Ottawa. Camille has experience as an NICU nurse, a pediatric nurse, a community clinical coordinator, and a nurse advisor at the Public Health Agency of Canada. Camille's career path brought her to her current unique role as a professional practice advisor. She bridges her different skills and experience to provide valuable leadership and innovation aimed at optimizing the quality of care provided to clients from Eastern Ontario and specifically adapted to those living in a Francophone minority setting. Welcome, Camille.
Thank you very much, Susan, for that introduction. So I am delighted to be presenting today on behalf of the entire professional practice team actually at Montfort. This is not a single effort on my behalf. It's been a lot of work from our entire team. And so today I'll be presenting on reconnecting with champions through an evidence-based open house. Before I go ahead with the presentation, I do want to acknowledge that I am presenting from Ottawa, which is located on the traditional unceded Algonquin and Anishinaabe territory. So going forward today, my objectives are first to describe a little bit how our initial context to our hospital, our strategic plans kind of built this initiative, this event. Then I'll go into detail about how we built the open house, which is what we call the theme day. So going through theme selection, planning, the format, also going into detail how we integrated an interprofessional concept throughout our event and made sure our champions really shined throughout the entire process. I'll also go through the impact of the event and the lessons learned for future opportunities. My aim at the end of this presentation will be to efficiently highlight how to creatively reinvigorate care teams' engagement in optimizing quality of care and implication in BPG work. And I also want to have a second objective, which is really to promote an interprofessional approach in champions' involvement and their role in BPG-related practices. Oh, sorry, I went a bit forward. Okay. So first, I want to set the stage a little bit with some context around our hospital and our organizational priorities. So that includes also our triple BPSO designation, which we are very proud of. Also going through how we've navigated staffing challenges post-COVID, so addressing human health resource shortages and clinical staff's disengagement. I'm also going to touch quickly on our role our professional practice team has in optimizing and promoting evidence-based care and BPGs. Oh, sorry, it keeps going further than I wanted to. So Hôpital Montfort is the only Francophone academic hospital in Ontario, and we have been since June 2013, but we've been affiliated with the University of Ottawa since 1992. We've received accreditation with honorary standing in 2014, 2018, and recently in 2022. We are very happy to be providing services in English and in French, and we've been in a unique partnership with the RNAO since 2009. Just some quick stats, we have 309 acute care beds. So some of our organizational objectives that have really been the guidelines for this event have been the following. So aiming to provide exemplary care in collaboration with our partners, making sure that Francophones living in a minority setting will have access to quality healthcare services, allowing all members of the staff to benefit from an inclusive, stimulating, and safe work environment, and making sure patients and their close ones will live an exceptional experience with each interaction. So this is kind of our guiding principles to make sure that our event is aligned with our organizational plans. So as I've mentioned before, we're very, very proud of our triple BPSO designation. So we are a BPSO direct. So our internal work implementing over 10 BPGs has been going phenomenally. We also have the BPSO OHT designation. So we collaborate very closely with, for example, Ottawa Public Health, Montfort Renaissance, and we've created some wonderful projects with them. And we're also a BPSO host for a Francophone collaboration with some partners in Switzerland and Casing. From our team's perspective, the professional practice is really aimed at reinvigorating nursing and other clinical staff's engagement, not only in patient care, but also patient support. We're always trying to improve the quality of the care while being based on best practice guidelines. We're also aiming to progressively implement additional BPGs internally and through our OHT, and continuing our collaboration with national and international partners. We also are aiming to improve our collaborative and interprofessional approach internally. So this gives you a bit of an overview of where a hospital is trying to go and where our event is really anchored. So I'm going to go over some of the strategic approach, the logistics, kind of the nitty-gritty details of how we created this event. So I'm going to talk about how we selected the theme, made sure it was aligned with our BPGs, talk about the actual format of the event and how we made sure it was an interprofessional event, how we promoted our champions' expertise, and how we optimized the visibility of our event to make sure we reach as many people as we could in our organization. So to select the theme for our theme day or our event, we did an internal consultation within our professional practice team, which is mostly made up of nurse educators. Our aim in this internal consultation was to identify training and learning needs. So whether it was based on trends in incident reports or what was seen directly on the care units or within their teams. So we also made sure we were aligning with the organizational priorities that I mentioned earlier. And we wanted to make sure we were addressing the needs of our population, which is an aging population. So this all led to the selection of the senior-centered care theme. We were also making sure that we were really aligning with our BPGs that we have implemented internally. So this was really anchored in the patient and family-centered care BPG, but also these sub-themes or the stations that we had during the event were all aligned with BPGs as well. So for example, we had a station on falls prevention, one on end-of-life care, one on assessment and management of pressure injuries. For the actual format of the event itself, it was hosted on October 4th, 2023 in our hospital's auditorium. So it's a very large space that's right next to the main entrance of the hospital. So it was very accessible by anyone who was walking by, and the actual setup in the auditorium was walk-up kiosks. So each kiosk had a specific sub-theme. So for example, like I mentioned, fall prevention, and it was hosted by a champion. This was an open house concept where anyone could attend. So clinical staff and non-clinical staff was welcome. And we made sure to have 3 blocks of 2 hours where the auditorium doors were open between 7 a.m. and 4 p.m. This was made to allow all 3 shift rotations to attend. So people who were finishing up night shift could attend, people during day shift, and before starting their evening shift. We also had the pleasure of providing snacks and coffee as incentive to lure people into the event, which worked very well and served also as a thank you to people who took the time to attend. Another underlying mission of or objective of this event was really making sure we got to showcase our champions and empower them. So we have a great pool of interprofessional champions, which we're very proud of. And so one of our stations was actually on our new interprofessional and collaborative model of care. So giving more information on the initiatives that we're putting into place, but also showcasing how diverse our champions are as they hosted the various stations. So for example, we had champions who are nurses, physiotherapists, occupational therapists, etc. And it was really a great opportunity for them to highlight their expertise and experience by sharing their knowledge directly with their peers. So we're very proud to see them shine. We wanted to make sure our event was a success. We wanted to make sure we could reach as many people as we could. So we had a very close we worked very closely with our communications department to make sure that we had great promotion strategies. So they developed these visual posters that are on the left, which are very catchy, which were disseminated online, posted at employee entrances, posted in care units. We also made sure that the communications department sent out a reminder for the event in our weekly newsletter. And we asked managers and nurse educators to also send reminders by email to clinical staff. Another part of our visibility was promoting our BPSO status and our direct collaboration with the RNAO. So we have these wonderful posters that you can see in the middle right, which showcase our BPSO work. These are permanent posters that we have posted in the entrance of our hospital. But we also got t-shirts made with the Hôpital Montfort logo and the BPSO logo that all our champions wore at their stations. So we're really trying to show how all the wonderful work that we've been doing. Then our communications department also posted some LinkedIn posts and Facebook posts after the event to show the success story of our theme day. Now, we made sure to look at the impact of the theme day and the outcomes. So in the event planning, we made sure to develop a Microsoft Forms survey, and it allowed us to get concrete feedback from clinical staff and senior management. And we also made sure to have the number of attendance for the event. Since we were located near the main entrance of the hospital, it was very easy to attract a lot of participants, just piquing their curiosity, having the doors open, seeing our champions wear our t-shirts with the Hôpital Montfort and the BPSO logos. So we roughly had around 180 participants, which was a great turnout. Very diversified participants. So we had different healthcare professionals, but we also had maintenance and housekeeping attendants. We had volunteers, patients, and their families even showed up. We had students, community partners, so it was a great turnout. Oh, sorry. So through our Microsoft Forms that we developed, we actually put 2 open-ended questions that we wanted to really capture the participants' feedback. So the first question was, what information from this theme day do you consider relevant to your role at the hospital, so Hôpital Montfort? And the second question was, how can we improve future theme days? So what themes would you like to learn about? What duration would be best for you? What format would be best for you? And we provided access to this online forms through QR codes that were posted around the auditorium. These are some of the answers that we got. I'm not going to go over them individually, but overall, we got really positive feedback from everyone, including managers, really mentioning how valuable it was to have refreshers on best practice guidelines, best practice care, and the optimal use of our clinical equipment. In addition to the participants' feedback, we also had some members of our senior management be present or interact with our champions as well, which was really great to see how supportive they were of our event. So on the left, you could see our CEO, who's actually listening in on one of the sessions on wounds. In the middle, we have our VP of the professional practice. And on the right, we have our assistant chief medical director. Now, with all this feedback, especially how positive it was, we're gathering all the lessons learned from this initial event to inform future similar events, which are based on evidence-based practice and BPG promotion. So we looked at lessons learned on the format, continuing the support and the collaboration with our senior management, and how to improve recruitment of additional champions. The main lesson we learned considering the format was to include patient partners in future events. This is something that we could not do for this first theme day, but we want to make sure that we have a good representation of the patient's perspective on the theme that is presented that day. So either by hosting a specific kiosk or having them be implicated in different stations. We also want to reflect on different formats that could be considered, for example, bringing the event to the units, so being able to reach even more participants, or for example, having the day open for one long stretch of time instead of having specific time slots. That way, if anyone's swinging by on their way to grab coffee or anything like that, they could take the 5 minutes to attend some of the stations. One of the important things we want to consider for future events also is to potentially provide more than one date per theme day. This would allow more staff to attend. So for example, if I was working on the day of the event, I could maybe find time to attend, but if I was not, I kind of missed that opportunity. So if we were able to provide the same theme day on different dates, this would allow a wider reach. Like I mentioned, we really appreciated the support we received from senior management. It was really great to see them be present. This is something we want to keep going when we go forward with our future theme days. So either being present or just making rounds, this shows really their investment towards this kind of initiative. We also want to work with them to see what could be done to allow for paid time off for staff, or at least rotational cover on the units to allow clinical staff to attend without taking away from patient care. We also want to keep our collaboration with the senior management to promote these events throughout the hospital. They have a very wide reach, and we do appreciate their investment into this kind of work. We would also appreciate ongoing funds for any food or beverages. As I mentioned, it's not only a great incentive, but it's also a great way to thank the staff that shows up and takes the time to learn, and just our ongoing support towards overall BPSO work and champion recruitment. And so speaking of champion recruitment, this is one of our goals from the professional practice team. We want to not only increase recruitment, but we also want to optimize the interprofessional approach to recruitment. So in various ways, for example, we want to be able to recruit early. So implicating students as they're doing their clinicals, integrating clinical care assistants in the championship recruitment efforts. And we want to make sure there's dedicated time allocated for training and growth of champions. So working with managers to allow our staff to attend trainings, workshops, etc. We want to make sure that champion training is also part of our vision when we do the initial onboarding of all new staff. So this includes onboarding of physiotherapists, etc., anyone that works on the clinical floor with us. We also want to use the train the trainer approach. Here at Hôpital Montfort, we've actually taken the time to translate the Champions Workshop in French, which is better adapted to our Francophone staff and allows us to increase access to training in-house. So making sure that we can provide more opportunities for our champions to be implicated, and also allows us to reach a wider pool of potential new champions. So overall, this is our approach that we took to reconnecting with our champions and promoting evidence-based practice and best practice guidelines. On behalf of the entire Hôpital Montfort and the professional practice team, we really would like to thank the RNAO for the funding that was provided for this event. I hope that I was able to showcase how important and valuable this kind of event is for the staff and for us. And we hope our experience can inspire others to innovate in ways to engage champions and clinical staff in best practices. I'm going to take the time now to throw it over to Susan, but also open up the questions period. So I'll be happy to answer any questions or comments anyone has.
Thank you so much, Camille. That sounded like a highly successful, well-planned event, and one that generated 180 attendees and a lot of diversity in those attendees. Really strong champions open house event. We'll just give people a moment to put some questions in the chat box, and